Dr. Jonathan MacClements, thanks for joining us.
You're welcome.
We're talking about childhood obesity, and I guess the first question that you'd have to ask is how big of a problem is childhood obesity in the United States?
Well, that's an excellent question. Unfortunately, it's a disease that's increasing in number. Before 2000, we were worried that children were starting to gain weight, but now we recognize that in about fourth graders in the state of Texas, at least 40% of them are overweight. And this continues to become a worsening, increasing problem amongst our kids.
Why is childhood obesity considered to be such a health problem?
Well, there are a number of illnesses that are related to being overweight. So children not only run the risk of having high blood pressure, high cholesterol, increased incidence of difficulty sleeping, having a condition known as sleep apnea where they can stop breathing at night. And there's also a higher risk of diabetes.
How do I know if my child is considered obese?
Well, we want to be cautious that we don't start labeling children inappropriately, because my big fear is that children will run the risk of eating disorders if we unfairly label them. So if you're worried that your child is overweight, it's a good idea to go in and see your doctor so that we can do some careful measurements. We measure their height, we measure their weight, we take a couple of skin fold thicknesses, and then based on some calculations we can figure out if they're overweight or not.
And is there a difference between overweight and obese?
Yes, it's a continuum. You start off with a normal weight and then you head to slightly overweight based on what's called a body mass index. And then once you exceed a certain level of the body mass index, you are regarded as being obese.
And you mentioned it a little bit earlier, but let's amplify on it. Can a child develop heart disease, type 2 diabetes, sleep apnea, high blood pressure, these kinds of problems? A child develop these problems from being overweight?
Yes, and sadly what we're finding is that children who are overweight or obese have a much higher risk than we were expecting. So the risk of diabetes goes up quite significantly if you're carrying some extra weight around.
I've heard this can happen. I want to find out if it's really true. Is it true that a child's obesity can actually delay the onset of puberty?
Yes, absolutely. We're finding that boys have a delay in puberty if they're overweight, and interestingly, girls are more likely to start puberty early. At this time, we're not sure what the reason is. It's probably related to hormones.
If I'm a parent, if there is one single thing, what is the one single thing that I can do that would be most effective at preventing my child from becoming obese?
Well, the important thing is to realize that this is really a family issue. So we've got to get the family involved. We've got to make sure that we no longer sedentary, we get out and exercise, and that we as a family have good eating habits. So we encourage family members to get involved with the child's activities, encourage them to eat healthily, and to make sure that that we reduce the amount of sedentary time period that the child might experience. So for instance, we know that children who spend a lot of time in front of the TV or playing video games are more likely to be heavier than those kids who are out playing a game of tennis or a game of football.
How can I involve my child in overcoming her weight problem without undermining her self-confidence?
Right. Well, the way to ensure that the child doesn't lose their own self-confidence is to not pick on them about their weight. It's important for the child to realize that it took a long time to get to this weight, and that it's going to take some effort on the part of the family and on her part, as well as within the school in terms of improving activities, that it is a community effort in order to try and get these children to lose weight. There are, as I mentioned, about 40% of children right now who are classified as overweight. We don't want these children to have psychologically low self-esteem. What we're trying to do is encourage the community to get involved in this program at the schools to ensure that the kids have more activities at school, that when they're at home that they don't have the sedentary lifestyle, that instead of playing video games or watching TV, they get out and participate in sports or put on a pair of shoes and go walking. And then monitor how much food that you eat. It's okay to have snacks, but instead of having pizza, rather go out and have a banana or some apples or some healthy fruits. And there are some products that are available at the stores now that are 100 calories or less snacks, and we encourage that form of eating. It's a healthy approach to diet and lifestyle that we are encouraging.
Thank you very much, Doctor.
You're welcome.